The International Forum for Promoting Homeopathy comprises of homeopathic lovers, homeopathic doctors, and students, and we are doing regular sessions since last 1,403 days. And we have 3 sessions in a row. The English session, Hindi session is just completed. The English session, as you know, it is from 8 to 9, 9 to 10, we have a local language session in Malayalam. Uh, we are lucky to have another session from Canada because in this week, for Sunday, we have Dr. Sadaful there from Canada. And yesterday, we have Dr. Aya Ibrahim from Canada. And today, our guest is Dr. Davinder Singh from Toronto, Canada. And Dr. has presented some papers earlier in our sessions, and we are lucky to have such a wonderful person in this evening to share his knowledge and share some good articles on homeopathy. And today's subject is a basic book in classical homeopathy. As you all know that book reading is a very is one of the essential things that required to build up your career, as well as everybody is in a hurry which book to be read and which are to be eliminated. But definitely these kind of presentations will guide us how what to do, when to do, and how to read, and why this book is specialized in. So let us proudly welcome the guest of the day, Dr. Davinder Singh. Yes, Doctor, we are very happy to welcome you to this session.
Hello, dear friends. So thank you so much for inviting me here. And today, again, I will discuss a few books which are very, very important during our daily routine practice. Today, I will mention only the practical books which we used in our daily routine practice. So whenever we have a case, most of the times when we take the case, we got two types of symptoms. One is subjective symptoms and other is objective symptoms. So according to the organon of medicine, we should know signs and symptoms. Signs are objective and we can only see them if we know them. Dr. Perry Smith, he wrote in his book, your eyes will see only those things in which your brain should know that things. If your brain know that thing, your eyes can only see. If the face is red and you don't know the meaning of that redness, you will not give importance to that redness. So that's why science, which give a true information of the body. So this is the first book, Professional Guides to Signs and Symptoms. So there are lots of books which give you information regarding these signs. The first book which I want to mention this is that book is Harrison Practice of Medicines. If you read that book, because in this book they give a specific sign and their meanings. So this book is Lippincott, Williams and Wilkins, and they gave different type of signs and symptoms. So these are objective symptoms. Next, we again move towards the basic book, and the most basic book in homeopathy is Organon of Medicines. Doctors did not having a habit to read this book because most of them are they feel this type of books are boring because there is a philosophical background. But there are lots of doctors who explain, who simplify the meaning of the word which is given by Dr. Hahnemann. So these are few books. These are 3 volumes, and the author of these books are Alistair C. Gray. This book is the first book he is taking. Second is case management. And the third one is the method, in which the whole rules and regulation laws, different types of physicians who give their views regarding homeopathy, how homeopathy work, what type of constitution and prescribing, miasmatic prescribing, and keynote prescribing, isopathy, no source, star course. This book gave you all information what Hahnemann want to say in Organ of Medicines. Next, the author which explain Organ of Medicine, because I believe that if you standing in one point, there are 360 angles of thinking. Every physician who doing a practice, he has his own experience of a very single medicine. That's why I recommend every single author who is doing practice and he write it down in their own experience in the form of book, you should read. First, Hahnemann explain what he want to explain and what he wants to make the rule and regulation for homeopathy, so people can easily understand and use that information in daily routine practice. But after that, the standard of education goes down and people are not getting interest in reading all the basic books, but who are understanding homeopathy from the core of this homeopathic part. They understand the value of this organ. After Alistair, the person who worked a lot for homeopathy, that person is George Vithoulkas. And his book, Science of Homeopathy, he explained and simplify in their own way Organon of Medicines, in which he explained law and principles and principle of homeopathy in practical application. He worked a lot in Organon and on Materia Medica. He has a 13 volume of Materia Medica in which he explained, he gave their own experience. He write it down, his own experience in Materia Medica. One more author, which I personally very like, that person is Lucky Shafford. His book is Hahnemann Revisited. This one. In this book, he starts from very basic, the foundation of homeopathy, in which The first part, he explained the organon like rapid, gentle, permanent cure, law of principle, pathology, potency, alum potency, case taking, constitution, temperament. Second part, first is foundation. Second part is healing process. And in healing process, what we should know about the healing process, these are golden rules of prescribing, suppression, obstacle to cure, palliation, incurable diseases, and the third part is chronic miasm. He explained every single angle how we can understand the homeopathy in different way. He explained in this book. It's really simple language, very you can easily understand every single word, very basic language. So the students who just started their professional career in homeopathy and they want to make their base very strong, I really recommend this book to everyone. Very wonderful book, easily understandable, and he write it down all the basic topics in this book. When you understand this work and you want to take more knowledge in depth, the second part of this book is Advanced Guide for Professional Homeopath. Same author, Luke T. Schaffer. In this book, he explained organon again, but in different way. The first part in this book is advanced case taking. He explained case taking in the first book, that is very basic. And second part, what other things one professional homeopathy know while taking the case, in which he explained learn objectives. Objective. If you are sitting here and your patient is come inside and sit on the chair, what should one person or physician know when he enter sitting and look at you? You should know about objectives. Second, examine the seat of leakage and recognize an acute exacerbations of chronic miasmatic state, common and uncommon symptoms. Because if you know common symptom, you can only understand what is uncommon after that. If you know uncommon, then you can only understand what is uncommon. Core delusions, remedy blueprint, patient constitution, attitude type according to the Carl Jung, 4 function of consciousness, 8 psychological type, active miasmatic state, and intrauterine question for cases of challenging children. This is one of the most important part of every single homeopath who treats patient in general, especially who give homeopathic medicine for next generation. What happens when one child is born with disturbed mentality, born with missing organs, they born with microcephaly, they born with the retardations of the organs, they are not able to understand things properly, they are late. So in all these conditions, you should the 9 months of pregnancy. And I recommend everyone, if you read embryology before reading this book, you will definitely understand what he want to say. How we can treat a woman having a history of or having a family history of this kind of children's. When you know that this woman or that woman having a tendency or having a family history of retarded children, embryology and this book, the Advanced Guide for Professional Homeopath, it will give you 100% basic information how we can treat these patients and how we can take the case of these patients. When you read these two books, then every homeopath should maintain that level. And the third book of this series is this one, Achieving and Maintaining the Stimulum. This is the advanced level of these two books. If you see, in this book, he explained potency. In cases of similar and dissimilar diseases, primary and secondary action, potency and management of the 4th, 5th, and 6th edition, then the significance, especially in the management of the case, the significance of accessory symptom and related problem, external symptoms or local diseases, modern homeopathic myths and misconceptions, acute, intercurrent, and intermediate remedies in chronic, and chronic intercurrent or no source in chronic diseases, second prescription, complementary remedies, and remedy that follow well. It means this gives you information regarding how you can manage the case. First, you should know how to take the case. What should you know before taking the case? After that, you start taking the case. What should you ask the patient? What question you should ask is present in Advanced Guide for Professional Homeopathy. And after that, how you can manage these cases. What a physician should know when he give the medicine to anyone. Dose, potency, how if your remedies not work, well selected remedies not work, what should you do? This book give you the whole information of that one. So this is advanced, very, very advanced. So this is basic to peak. After that, one of the most basic book, and I believe that every homeopath in the world have this book, and that book is Boric Materia Medica. This is very basic, very basic. When any physician having a very interest in pathology, he know how to diagnose the patient, especially in allopathic way. If the person having a experience to diagnose the patient, if the physician should know how to identify and how to see the sign of symptoms, and you are very advanced in understanding the pathology, especially internal or external, you should know this book. There are lots of book remedies in which he explained the direct pathology. And one more book I mentioned a day before, that the book was Boger Synoptic Key. This is totally based on pathology. If your pathology is very good, you understand, and if your practice of medicine is very strong, then you can see the patient and give the medicine. He explained remedies in pathological way. This book have a two-part. First is Materia Medica and second is Repertory. And in his repertory, he gave direct pathological terms, and very valuable book. So if we move forward and we are talking about pathology, a physician is very interested in pathology, and he is able to diagnose the patient. He able to understand the type of pathology. He can understand the level of that pathology. Then he always seeking for the therapeutic differentiation of the remedy. After that, he will always seeking for the pathological remedy, or especially therapeutically. So I recommend this book, The Science of Homeopathic Therapeutic, having a 2 volumes. First volume, he explained the therapeutics, especially in way of pathology. And what is important in this book is he explained pathology. After that, he explained the clinical sign and symptoms, differentiations of that disease, and after that, he explained how homeopathic remedies act in this particular disease. Pathology, after that, sign and symptoms of that pathology, and after that, he explained the remedies, which is one of the best way to understand any disease condition. Very similar. This is explained by Dr. Charles Hampel. Charles Hampel. In very similar way, Dr. Grunese, the book name is Homeopathic Domestic Practice, containing also chapter on physiology, hygiene, anatomy, and materia medica. So this is one of the best book, because Grunese having a big name in homeopathy. I already mentioned his materia medica, especially keynote materia medica. In this book, first he explained about the disease. Second, he explained by the treatment, especially allopathic way or homeopathic way. Then diagnose the condition. Then what type of hygiene you can use while managing the case or managing the disease. So this is very basic book in which he explained almost all diseases plus remedies plus the way of prescribing plus physiology plus hygienic conditions, and he explained every part, especially every single part of the patient. Fevers, cutaneous diseases, affection of stomach, affections of windpipe and chest, mind, head, nose, every single part. And if you start your practice and wants to make your base very strong, read these two books. They explain pathology, physiology, management, treatment, hygienic conditions, homeopathic treatment, everything. How we manage the case. After that, one book which I really like, and I explained lots of information and I did lots of seminar on the basis of this book, that is vaccine-free preventions and treatment of infectious contagious diseases with homeopathy, a manual for practitioner and customers. Dr. Kate Bridge. Every physician, because in this book he explained the diseases like rabies, tetanus, polio, diphtheria, whooping cough, mumps, chickenpox, smallpox, anthrax, plague, otitis media, influenza, mononucleosis, pneumonia, tuberculosis, genital warts, gonorrhea, AIDS, hepatitis A, B, and C, typhoid, malaria, dengue, cholera, everything. And what is the specialty of this book? He explained the disease condition first, and after that, vaccination and allopathic treatment. After that, homeopathic preventions and treatment. And he explained every remedy in which we can use and how we can prescribe these homeopathic aid in these advanced pathological or unknown diseases, especially when these infectious diseases are there. Because I have seen one case in which I used this book and I prescribe the remedy. So next book, which is continuations of this, these books are, these are the experience of homeopathic physician. These books. First is 40-year experience, Dr. Jar, and clinical experience of 70 years in homeopathy, Dr. Kopikar. In these books, they explain their experience, how they fail, how they get success, how they differentiate different remedies, how they differentiate pathology, how they prescribe the remedies, which remedies give them best results in any particular disease. So we cannot do every experiment with their own, but these books are the 40 or 70 year of experience. It means they work, they did practice up to this much time. And if we read all this book, all the part of all the pages of this book, we can easily understand, we can easily grab the information or the hard work of last 40 years of this person or 70 years of this person. So it means we have now, if we have 1 year of in our own experience, we can get 40-year experience of other person and we can learn from that. After that, as I said before, every person is explain a remedy in their own way, because maybe the way of prescribing you learn from your experience, maybe the other person learn the opposite side of that remedy. So if we continue the reading section, the next remedy which I really like is this book, The Manual of Homeopathic Medicine, Dr. Jar. He explained homeopathic medicines in their own way, and he differentiate the remedies. He give what he see in their practice. This is the basic book of homeopathy. Acute diseases are sometimes very difficult to understand if the person is very new in homeopathy, especially fever, acute diseases like coryza, like a chest infection, bronchitis, or any feverish condition. So I recommend this book. The writer is Dr. Allen, and the therapeutic of intermittent fever. He explained every remedy which work in fever condition, what type of symptoms you can see while taking the case, especially of fever, what you have to see in the patient. this book is especially for the new homeopath who just started their practice and want to learn more things. This is the best book for them. Best book. So I recommend 2 more books who really like reading, who really like to know the experience of others, and who really like to advance their knowledge. These 2 books. First book is Miasm as a Practical Tool, and second is Mental Symptoms in Homeopathy. He explained with the cases how you can use these mental symptoms in our daily routine practice, how we can understand the value of symptoms, how we can understand how these symptoms coming from the patient, because you can only see these objective symptoms, because mental symptoms are mostly come objectively. If you ask them, then the type of or the shape of the symptoms will change. Next book, as I mentioned before, that we can learn from the experience of people. The best book, Dr. Burnett. Best of Burnett, in which he did observations, materia medica notes, differentiation, a different pathology, physiology, advanced pathological case. He explained every single thing here. Case reports, and you can read this book to advance your knowledge in homeopathy. And the people who are working on cancer, this book is good. Homeopathic Therapeutics of Cancer from the Master of Homeopathy, Dr. Clark, Dr. Greimer, Dr. Bonovelli, Dr. Cooper. Very, very good book. Who just pursuing the cancer. How cancers start, how we can treat them. And one more book I want to show you. This one. A Homeopathic Approach to Cancer. Dr. Ramakrishnan, Dr. Catherine Kochler. These are the 2 authors who explain how to approach the cancer. The person who is really interested in reading and really want to know their remedy in depth, especially in mineral kingdom, this book is written by Dr. Otto Lesser. And if you see most of the book who explain minerals in different way, most of them is refer this book to you. If you see the reference in the back of that book, they always refer this book. Homeopathic Materia Medica, especially textbook of Homeopathic Materia Medica, a study of minerals, mineral kingdom. He explained every mineral in very, very detailed way, very detailed. Every single medicine, if when they are in mixture way, how they separated and they purify, how they purify and how they use this substances as a medicinal substance. I want to recommend one more book. That book is Dr. B. Moore's Materia Medica. He explained lots of new remedies, and you can use this new remedies in their daily routine practice. This is a wonderful book, and this is all based on proving. If you want to read the old literature, this is one of the very good book, and the name of book is Practical Observation on Some of the Chief Homeopathic Remedy by Dr. Franz Hartmann, translated from the Germany with noted by Dr. Howard of Philadelphia. He explained only two remedy in this whole book. One is belladonna, one is nux vomica. And you will shock when you read only these two remedies. This book having a more than almost 200 pages just for two remedies, belladonna and nux vomica. He gave lots of different points. He gave lots of experience. He wrote down lots of experience of their daily routine practice in this book. Very wonderful book. And if you are very, very interested and you are very like to read the novels, then I recommend this book. Novels. Portraits of Homeopathic Medicine. He just write it down medicine in the form of novel. Explain very, very simple language, easily understandable, and you can use this remedies in your practice. Nux vomica, Silesia, Agnesia, and a few no sorts he explained in this book. After that, our main honor, I say honor, of the homeopathy, Dr. Hahnemann. He is the only person who is the father of, or who is the main person through which all these books are coming. The person is the last and very, very important book is the lesser writing. Lesser writing of Hahnemann, lesser writings of Kent, lesser writings of Frankton, and lesser writings of Bonning-Hassan. In all these books, he explained their experience, or he explained their observation in practice. If you want to compare the remedies, I recommend this book. Comparative Materia Medica of Frinton, and he differentiate word to word. Every word he differentiate, every single word to everyone, to every single one. And next, very interesting book in for the kids and that family. This book is Paul Herschel, The Homeopathic Treatment of Children, and he explained detail wise. He explained few remedies, but in detail, very very detailed. He explained calcarea carb, glyco, medorinum, natramure, phosphorus, falsatella, sulfur, and tuberculin. Very very good book. And if you want to learn more for the kids, then I recommend this one. Essence of Pediatric Materia Medica, Dr. Praveen Jain. This is very, very good book. He explained every single remedy, how to rule out, what are the entry point, what are the differentiating point, what are the axes, what are the keywords, what are the mind peculiar symptoms in infant, in toddler, in school going child, how they react, and physical level, what are the peculiar symptom in physical level, how you can rule out the remedies. So these are the basic books which I really recommend everyone to read. And now if you have a questions, you can ask.
Yes, Dr. Devinder Singh, it's really a very good session. You really introduce all kind of books which are really beneficial to a homeopathic doctor. Frankly speaking, we never thought of such books are there with you, but your this table itself shows how much of books you are there with you, and it is just like a library in your room, and you are
Yes,
and you are spending very good amount of money for purchasing this homeopathy and studying this kind of intense knowledge acquiring process by you really is a great thing to know. And if every homeopath do like this, definitely we will not get any time to go for any other business. That much of things are with you. And anyway, it is really a very good session. You really introduce some of the books we never heard or never thought of. And then, frankly speaking, as we all know that after repertorization, when a person get a medicine, then then there is a confusion that this medicine or that medicine should be given. Then we will have to confer the medicine with the textbook. So usually people used to go to this Boric or Keynote or some other medicine books, but for differentiating the getting the right medicine, you can choose some of these books as your pointer. That's the beauty of your presentation.
yeah. So
And
basically, most, because when I was new in this field, I always thinking to other knowledgeable person who really not interesting to tell about the books, because maybe they have a busy schedule, or maybe they don't want to show their knowledge or show their books. So slowly, I make I purchase all this book and I read, and slowly I get how what will be the first step, and after that how we can go advance, how we can which book after which book we can read step by step, because we cannot understand the advanced level if we don't have knowledge of basic things. And if you read the advanced book first, you never understand, never understand.
Which book you prefer the best for using such in those conditions? Usually we prefer this boric or some other medicine, but which one you rely more on that?
So actually, every person having a different way of prescribing the medicine. I prescribe mostly on keynote.
Yes.
Okay, and mostly in advanced pathological cases, I never use big repertories. Mostly Bonning Hassan is the basic repertory for me, and I never believe on repertories. Always preferring the materia medica. Keynotes, in which I recommend always the Allen's keynote. If you didn't find in Allen's keynote, go to Hering's materia medica, condensed materia medica. And if you don't get in condensed materia medica, go to the guiding symptom of materia medica of C. Herring. If you have a pathological case and you don't have much symptoms and you want to just open up the case, I recommend synoptic key. And if you not understand the synoptic key, then you can refer Pathak materia medica. And if you want to get more information, then Boger Bonning Hassan having a first part of materia medica. You can see that book.
Whether you go for repetization in those cases, and then you choose the right remedy, or whether you directly go with the keynote symptom.
Mostly, I didn't use repertory. Most of the cases, I didn't use repertory because I always try to differentiate the symptoms. What I getting from the patient is mostly clear out while taking the case. And when I stuck over there,
that means
whenever I stuck, I
that,
always use Pathak repertory for this one.
that means you are an artistic prescriber rather than a classic prescriber.
I use everything.
Okay.
It's depend on the case. Because in Canada, most of the time the medical system is totally free of cost. And any person having a complaint, they directly visit the hospital. And what we get when they are not getting results from hospital, then the person visits us. So these all books, there are lots of books behind me, but I didn't mention all the books because we need more time.
Yes,
but these are the basic book. If anyone wants to know about from low level to advanced, then you can ask. I can really interested to show you how we can go from first level to advanced level.
Definitely, we can have some other presentation the next in this same month or on the coming months, as per your convenience. If you are ready, we can do it on the 3rd week of this month itself.
Yeah, sure.
Okay. So we can arrange such a session, because this knowing what are the tools for homeopathy. The tools are with you, but nobody knows this much of tools are with us.
Yes.
Then you can, whether you have to choose the scissors or scalpel. That is the basic difference one had to decide.
Yeah.
Just like that, you have to choose the right book at the right time and to pick up the right book and then go with the right prescription. Definitely, you will be a winner like that.
So
Okay.
basically, I actually know because I show these two books like this one and this one, the
Yes.
Hampel's Therapeutics, and this is the Grunese books. Sometimes we know that, for example, I have a case having a hysteria. I give you a small reference, and you are sure that this is hysteria. Then you have to search out hysteria. I searched out in practice of medicine, but I didn't find that much information in practice of medicine. This book having a big chapter on hysteria, and he explained every single part, every single remedy, how these remedy react, act, and behave in their own way in hysteric condition. That is really wonderful book. Really, really wonderful.
Thank you, Doctor. Now it is the time to wind up the session. If anybody want to speak to our guest, you can raise your hand for 1 minute, or otherwise we can go for the vote of thanks to Dr. Rambarish, sir. Doctor, Dr. Ahmad Hassan, are you there? You want to speak? Dr. Ahmad Hassan? Oh, he was okay.
So he wrote down that respected Dr. Saab, with the due respect, kindly share the following name of the book, authors, publisher, if convenient, always stay blessed with the, okay. So
Okay.
uh, uh, okay, I will share all these books and publication, because sometimes because most of the books uh, have published by BGen, but few books are coming from different countries, and like in Germany, from Netherlands, from UK, England, or Greece, like these countries. So maybe they are available there or not. I don't know.
Anyway, next during our next presentation, we can give a writing for the same.
Yeah,
Anyway,
I will try. I will try my
okay.
best.
Okay, now I invite Dr. Rambarisa to say your comments as well as what the thanks to the session.
Thank you.
Please unmute. Rambarisa, sir, please. Yes. Yes, you are muted, but we can't hear you. Okay.
Ganesh ji,
Yes.
and congratulations, Dr. Devinder Singh ji. Very nice presentation. Important book. Very important book. Classical homeopathic book. Deals. Knowledgeable book and practice life. Very, very thanks. Behalf of IFPH. Again, presentation second. Thank you. Thank you very much.
Thank you, sir. Thank you so much. Thank you.
Thank you, Rambarisa, sir. And with that, we come to the day 1404. And tomorrow we will have a session from Dr. Partha Chakrabarti from Malaysia, and sir will be discussing about a dying case of a regenerated heart by homeopathy. This is what all about the session, and we thank all of you, particularly our guest of the day, Dr. Devendra Singh, for this wonderful evening. Thank you all. Good night. It's over to Dr. P. Shaila to moderate the Malayalam session.